Welcome to this video series on the Wellness Program resources. Our topic for this video is worker health costs. How much is worker health costing your organization? Number 48. As a wellness program consultant, I was once sitting with a group of senior managers. I had an organization that had 24 hospitals. It was a multi-state hospital healthcare system. And I was asking them essentially how much were they spending on the health of their employees. Well, as I asked that question, I saw them get a little nervous. Like when kind of eyes darted around a bit. And I found that they really didn't have a very good idea of how much money they were actually spending on worker health. They were confused partly by the discounting process that healthcare institutions usually give themselves for their own employees' health care. They also did not have a good idea about what were the major issues that they needed to look at that really reflected the health and the cost of health for their workforce. I started going through the 5 major health costs that we're going to be covering in a moment. And I found that there was a sense of denial among several of the senior managers about whether this was really very sizable or not. They really didn't have much of a sense of how much economic resources were going into the cost of the health of their employees. They had some idea about the cost of health plan cost, even with the confusion of discounting and actual real costs. But they began to kind of get both a little bit frustrated with me as well as with each other in terms of not being able to really say much of any tangible nature about those costs. They continue to kind of feel like we're a healthcare system and we don't need to worry about healthcare costs because that's what our business is, it's our core business. And they really kind of gave me that particular position in several different ways. I decided I was going to continue to challenge their thinking on this. So I began to give stats from the national picture from the Bureau of Labor Statistics and the information for different kinds of industries. And I believe that they slowly began to rethink their position on this issue of whether cost and worker health costs were in fact an issue of importance to them as a organization. I decided I'd use this opportunity to help develop a methodology I could use for other clients and other organizations. I essentially offered to do an analysis of their cost. And I developed a tool that we're going to talk about in a moment. And then used totals and per capita cost estimates for the various major worker health economic variables. And then when they saw that the numbers, when I brought them back to them as a group and we talked about how much they actually were spending, they were all pretty shocked. And that led the way to the issue of being able to move into a more strategic attitude toward the wellness efforts and the well-being efforts that they were thinking about doing. So before we go into the tool itself, let's go over the main economic variables that make up worker health costs. There are essentially 5 major types of worker health costs, and the first and largest one is obviously health benefit costs. And the design of health benefits, the coverage eligibility, the types of providers, the use of preferred provider types of PPO type structures, consumer driven health plans. There's a lot of issues around your health benefit costs. There also are usually a lot of administrative costs that we don't necessarily add up and think about when we are dealing with health benefit costs. In non or fully insured cases, employer cases, we're generally looking at the premiums that are set aside to cover the expenses that we believe we're going to encounter with the populations that we insure. We modify things like eligibility, deductibles, maximum out of pockets, premium contribution levels, a whole series of decision points around our health benefit coverage. And that cost is sizable. It's currently averages somewhere between about $18,000 and about $24,000 a year per employee. So it's a fairly significant cost for most businesses. So we do want to do a good job on getting a clear picture of what the costs are for our health benefit coverage. The second major type of worker health cost is sick leave absenteeism. And you have two different kinds of situations around sick leave, actually three. The first one is you don't provide sick leave coverage, and there are many employers that don't provide that. The second is what we call a dedicated sick leave approach, and that's where we give people 8 to 12 days of sick leave per year, and we may have an incentive for them not to use them. We may give them an opportunity to convert them at some rate into annual leave days. There's all kinds of different approaches we use, but sick leave absenteeism, dedicated style programs usually are the easiest for us to look at and get a sense of what the cost is for the employer. The second kind of situation you run into, or actually the third of that, so we have situations where you don't have any sick leave. Second one is a dedicated sick leave system. The third one is where we use a combined leave, sometimes called paid time off systems. And that's where we essentially roll all of our leave days into one category, and they're just called annual leave. And we convert our sick leave and grievance leave and hardship leave and all kinds of different types of administrative leave into a set number and then convert those into days off. So those are actually pretty good approaches because they give us an incentive to take better care of our health and not to experience real sickness that allows us to use a day but not the way we'd like to use it. So that combined leave system is actually good for wellness, but it does in fact take some of the cost elements out of worker health cost. So sick leave absenteeism we're going to look at, and we're going to look at some ways of being able to determine what the costs are for both the situation where you have a dedicated sick leave system and or the combined leave system. The third type of worker health cost is workers' compensation costs. And workers' compensation comes from a long history of employers covering the cost of work-related kinds of illness and injury. And these are usually quite different depending on the type of risk that the employees experience. So we have very high workers' comp cost in the construction industry, in the oil refinery and offshore drilling, and there's a number of different groups that have a much higher workers' comp cost. And that's usually in the form of a premium cost. It goes oftentimes to our state government and the occupational health or industries part of state government. That workers' compensation cost, again, is both illness and injury that is work-related. The fourth type of worker health cost is disability insurance costs. And about 40% of employees in the U.S. have short-term disability. Another 23% have both short-term and long-term disability. And those cover a period of time where we can't work, and they in fact provide us with a base salary or base salary amount or base wage amount that will allow us to continue to live without great economic hardship when we can't go to work for an illness or injury that is not work related. So that's a disability insurance cost. It's a supplemental, it's an elective benefit. Employers, decide if they want to offer it. By the way, we really should offer short-term disability to all employees. And having gone through the pandemic in the last several years, that a lot of people were injured quite badly economically because of the lack of short-term disability coverage when they particularly got long COVID. The fifth and last of the types of worker health costs are presenteeism costs. And presenteeism costs we're going to spend several videos on, but it's the loss of productivity that occurs when I stay at work, but I have an underlying health problem. And we're going to look at some of the dynamics of how we estimate that cost, how we determine what it is for our organization, and its relative size to some of these other cost areas. So in summary, the total cost of worker health is usually at least twice to 3 times the cost of the health benefit plan. But each organization needs to derive their own cost experience. And this is because we have unique benefits, we have unique risk and liabilities under each of these 5 different types of worker health costs. Now, a link to this 3-page tool is provided in the description for this video. You can pause the video at this point and download it for free, and then follow along as I cover some of the highlights of this particular tool. Now, once you have the tool in your hand, you'll notice it's broken up into the 5 areas we just went through. The first one being employee health benefit plan cost. Then it moves into calculations for sick leave absenteeism cost. Then in the following page, it goes into worker compensation cost estimation, and then disability insurance cost estimation, and then finally presenteeism cost estimation. And then it provides also a summary table on the 3rd page that allows us to plug in the information which we acquire through the use of this tool. Now, this tool is really intended to be modified by each organization, and particularly the wellness program manager or the wellness coordinator, and then given to the financial management group in your organization. And there actually gives directions for how they pull together these costs, these 5 areas of cost. And in each of the 5 areas, it asks for the financial management team to basically put together the total worker health cost for each of the 5 areas. And we have an estimation technique, which we're going to talk about for the last one, the presenteeism related one. The other 4 areas are going to be part of the financial management records of all organizations. It's also required that they have to report these annually. So it's part of our tax in IRS contributions, IRS record keeping. So the summary table on page 3 identifies where you plug in the total worker health cost for that particular specific one of the economic variables, and then also the per capita cost, because we want to do both of those, and we want to use essentially the same information of employee head counts to come down to that per capita estimation. That's a very useful way for us to be talking about the health and health costs of our organization. Once we have some of the total health costs, we can also begin to look at a comparison of those costs to things like the after-tax profitability or net revenue of our organization or business, and the total payroll expense or gross revenues or net revenues or new budgets or planned new annual revenue. So it can begin to use these 5 areas of cost to then compare with important other economic reference points that management usually wants to use and wants to have insight around. This is economic intelligence into intel that you can use to actually look at the strategic importance of wellness and well-being kinds of activities. Now, in summary, you can create your own worker health cost pie chart, similar to the one that we may have shared with you in one of the previous videos. So you can do your own pie chart, which then gives you the numbers for your particular population. On a national level, the average is around $40,000 per employee per year, tied up in these 5 economic variables. So that's not an unusual amount. That's a much larger amount than virtually all managers think about. If you ask them, like I did with the hospital system client, about how much they were spending on worker health. You also can look at the total cost and per capita cost, because we want to be doing, budgeting around per capita, because we want to have our very small amount of money that we usually spend on wellness. We need to spend more than we usually do, and this tool will help you get larger budgets for your wellness program. But we want to be looking at per capita healthcare costs. We also want to compare it to those other important economic reference points that our CFO and CEO and COO usually want to know something about. You can also make wellness more of a strategic business imperative, something that management puts much more importance into once they see the economic data that this tool provides for their own organization. It's one thing for them to deal with the national data. It's a whole nother one for them to deal with their own data. And particularly not just a snapshot of where it is right now, but how much is it likely to increase over time. Healthcare costs have generally gone up anywhere from 1 to about 4 times the rate of the consumer price index. So we really have a lot more of our business and nonprofit and governmental resources, organizational resources, going into the health-related cost. But most of the time, we only look at health plan cost. We don't look at these other 4 important areas. And you want to secure strong senior management support through the use of this tool. This is designed to help you get a better support level for your programming. It's also designed to help management feel more comfortable putting more resources into a wellness program, and particularly a results-driven kind of wellness program. Now, in summary, this week's topic is about the importance of helping each organization determine the true cost of worker health. By doing so, you will help senior managers see the strategic importance of wellness and well-being efforts. I want to thank you for watching this video, and be sure to subscribe to my YouTube channel. New videos are published weekly. And you can, for more information, search for the WellCert program. WellCert is the premier professional certification for wellness program leaders. Be sure to check out the program if you want to improve your wellness programming skills. And remember, delivering great employee wellness programming is a high calling. Let's do our best to get the job done. Good luck with your wellness programming efforts.